My name's Ethan, and I am 12 years old. I have a genetic disease called cystic fibrosis. This is the day in my life having cystic fibrosis. Every morning I take a lot of pills. One is for my liver to keep my levels down. Some are vitamins, since my body doesn't absorb vitamins, as well as people without CF. An allergy pill for my sinuses. And the last two are an amazing new medication called CFer. CFer helps CFers with GI issues, increase in lung function, and has helped with weight gain. Most CFers need to take enzymes when eating to absorb nutrients and help with weight gain. But due to medications like CFer, my body started to absorb the nutrients from the food I eat, making it so I no longer have to take these pills. I need to take 22 enzyme pills each day. You can imagine my excitement. This is uncommon for most CFers. I have to do treatments 2 times a day, even if I'm healthy. In the morning, my treatment takes 50 minutes to complete. First, the butyrol opens my airways, then the hypertonic saline thins out the mucus in my lungs. Finally, I end my treatment with the vest machine. It breaks up the thin mucus even more. In the evening, my treatments are 20 minutes shorter, but look somewhat the same. Instead of hypertonic saline, it's pulmozyme. Then, I finish with the vest. According to CFF.org, cystic fibrosis is a genetic disorder that affects the lungs, pancreas, and other organs. According to Emily, Entourage.org, people with CF can't be together. Twice a day, once in the morning, once at night, I do a sinus rinse to help clear out my sinuses. I've had 2 surgeries to clear out blockages and remove any polyps that were found. According to CFF.org, more than half of the cystic fibrosis population is over 18. At least 4 times a year, but usually more, I have to get a blood draw to monitor my liver, my vitamin levels, check for diabetes, and many other things. On average, they take about 4 vials of blood. I have a special lab assistant who takes my blood as she can always find my small veins. Every 3 months, I go to the clinic, where I see my pulmonologist, dietitian, respiratory therapist, social worker, and GI. Here are 2 interviews with my pulmonologist and respiratory therapist.
I'm Dr. Diana Go. I work at Kaiser Roseville here in Eureka campus. I'm a pulmonologist, a pediatric pulmonologist that specializes in asthma, cystic fibrosis, lung diseases, and also sleep problems. I work with Brian Carbo, the respiratory therapist that you will see in the next video.
What is cystic fibrosis?
Cystic fibrosis is a disease that some children are born with. It causes thick mucus in different organs of the body, including the lungs, the intestines, the liver, and the pancreas. And when a child has cystic fibrosis, it's because of the gene, an abnormal cystic fibrosis gene, that they get from both parents, from both the mother and the father. If they get only one of the cystic fibrosis gene, it does not cause cystic fibrosis. But the child with the cystic fibrosis gene can give that to their children. And so in cystic fibrosis, a lot of times they can have thick mucus that affects the lungs and cause lung infections. And over time, these lung infections can damage the lungs. And also this thick mucus can affect the liver, the pancreas, so that nutrients are not absorbed well when they eat, causing poor weight gain and abnormal stools.
What does a pulmonologist do?
Pulmonologist is a doctor who specializes in lung diseases. So in cystic fibrosis, it mainly affects the lungs. So the pulmonologist directs the care together with the dietitian, the respiratory therapist, the social worker, and the GI doctor, because cystic fibrosis affect a lot of different body systems and each person is different. So each child with cystic fibrosis needs specialized and personalized care, and the pulmonologist direct it and try to maintain the child with cystic fibrosis as healthy as possible to enjoy their lives.
How many people have cystic fibrosis in the world?
Currently, there are 30,000 people affected here in United States, but 70,000 worldwide. And more than 50% are 18 years old and above.
What are some of the tests CFers need?
So first, we talk about diagnosing CF. Every child born has to undergo newborn screening to test for cystic fibrosis, to screen for cystic fibrosis. But the primary test to diagnose cystic fibrosis is sweat test. Basically, that is applying some chemical on the forearm of the child and allowing the child to sweat and measuring the chloride content of the sweat to diagnose cystic fibrosis. The other test to diagnose cystic fibrosis is genetic testing, and it's through the blood. You draw blood and you send it to the laboratory. And other tests that a child with cystic fibrosis would need is the annual blood draw to check for liver function, to check for the electrolytes in the body, the nutritional status of the body, and the vitamin levels of the child. So that's done annually, and also chest x-ray to check the lung parenchyma to see if there's any lung involvement from cystic fibrosis. And that's what we do. And if the child is more than 10 years old, we do the oral glucose tolerance test to see if they have CF-related diabetes.
Hello, my name is Brian Carbo. I'm a respiratory therapist. I've been a respiratory therapist for coming up on 24 years now. I've been working outpatient with cystic fibrosis patients for the last 6 years, and I work at Kaiser Permanente.
What does a respiratory therapist do?
Respiratory therapy encompasses a huge number of things. Respiratory therapists work in the hospital with people with ventilators. We help deliver babies, and some of us work in the clinic and help people that are outside of the hospital. Respiratory therapy breaks down into going around helping relieve the effort of breathing. And that's what we do in a nutshell.
What happens during lung function tests?
During a lung function test, a patient will come into the office and use the spirometer. It'll tell us how big of a breath they can take and how fast they can blow out the air that's in their lungs. It doesn't hurt, and it's a relatively easy process, and it lets us know how healthy patients are.
What treatments are available to help with the lungs?
So there's multitude of treatments available to help CF patients with their lungs. We refer to it a lot as airway clearance, and respiratory therapists are very involved in airway clearance and making sure that our patients do their treatments daily. What we routinely offer is every day a patient will do some inhaled medications, followed by what's called a vest system, which helps shake up and remove secretions from the lungs, and that will be the end of their treatments. They'll have to do that twice a day.
This is me doing a lung function test at clinic. The lung function test tells my doctors how well my lungs are doing.
Normal breath. One super duper great big one. Blow hard and fast like you're blowing out my birthday candle. Keep blowing until I tell you to stop. Me too. You want to put those on? You want me to put them on? Normal breath. Normal breath. One more. All the way out. Super rapid breath in. Fast. Push, 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 push. Keep going, keep going, keep going, keep going. Rapid breath in. Awesome, dude.
When I'm sick, even if it's a runny nose, I have to do 4 treatments a day, sometimes 5. Sometimes when I'm sick, I end up in the hospital for 10 to 14 days on average. My longest stay was 18 days right before COVID. When I'm at the hospital, I'm hooked to an IV, which I hate. This gives me antibiotics to help fight the virus. I do multiple treatments a day. My parents take turns staying with me. My grandparents and my uncle will also help and take turns spending the night. My hope is that one day CF stands for a cure found. Thanks to the Cystic Fibrosis Foundation, progress has been made with treatments and medications. My hope is that in the near future, I won't have to do all these treatments and medications and that I'll live a happy, long life.